Welcome to session 9 of Employment and Education Support webinar series. My name is Vishnu Sundaram. I'm an occupational therapist with the Bedfordshire Chronic Fatigue Service and the BLMK Post-COVID Fatigue Service. In this session, we have put together some general guidance to follow when you are off sick. Let's see what they are. Many individuals with chronic fatigue often feel pressurized to continue working, especially when they first become ill or when their symptoms worsen. However, attempting to push through this illness can be counterproductive, potentially leading to longer periods of absence from work and delaying recovery. When you are off sick due to chronic fatigue, it is common to feel overwhelmed, which can make it difficult to focus on apart from your illness. Despite this, it remains crucial to be aware of your duties under your contract regarding sick leave. For instance, if you are ill for 5 to 7 days, you can typically have the option of completing a self-certification form upon your return to work. This form is essential for receiving sick pay during that time. However, if the illness persists beyond this time frame, it becomes necessary to obtain a fit note from your general practitioner, or otherwise called as your GP, who will evaluate your condition. Your GP plays a crucial role in assessing both the physical and mental impacts of chronic fatigue and can provide guidance on your capacity to work. They may indicate whether you are not fit for work or may be fit for work with specific adjustments. These suggestions may include a gradual phased return to work to support you back into your role, adjustments to your start or end times, or your shift patterns to better manage energy levels, changes to your job duties to better align with your current abilities, implementing workplace adaptations to support recovery and minimize physical or cognitive strain. Additionally, your doctor may suggest specific types of support that your employer could offer to assist in your transition back to work. While it is important to note that employers are not legally bound to follow these recommendations. If they choose not to accommodate the recommendations, then they should treat you as if you are not fit for work. If you are on long-term sick leave, your employer should maintain regular contact and discuss potential options for your return to work. This communication can help reduce your anxiety. Upon your return, your employer should develop a tailored phased return strategy that may last longer than the standard approach. This plan should allow for open discussions about your current coping mechanisms and identify changes that could facilitate a successful reintegration into your workplace. Alternatively, they may refer you to the occupational health department for an assessment to pinpoint the support and resources you need in your work environment. Most organizations have their own occupational health departments. If your manager or employer has not yet referred you for an occupational health assessment, it may be beneficial to advocate for this step, as it can provide valuable insights rather than focusing on barriers or assuming that employers know how to assist. In spite of the difficulties presented by chronic fatigue, remember that you still have valuable skills and experience. Don't hesitate to engage in conversations that highlights your strengths or talents and discuss possible contributions you can make. This can help you feel empowered as you work through your rehabilitation. Thank you for listening to session 9. In the next session, we will discuss about returning to work.